Andrew joined by Danielle Cameron from Interior Health to explain this program. This is a watershed moment where Interior Health is now providing injectable opioids for people who are caught up in this problem. Explain for people why that's a good idea for the health authority to actually be dishing out opioids.
Yeah, great question, Kent. So injectable OAT, or injectable opioid agonist treatment, is essentially a higher level of service to help people with move along their journey to addiction recovery for people who haven't had success with our traditional or our existing services. So we would offer it to people who we've already made connections with, who have not been successful with the oral methodology, and we would then move them into this as a higher level of care service, and then with the goal of then transitioning them down once they're feeling stable and ready.
Well, I think it is a good idea because there's people that are like addicted to just using the needle, and it's a good way to help them, like, because with fentanyl out there, right, it's so addictive and a lot of people are ODing. So I think it is.
I actually have never taken advantage because, to be honest, me as an addict, I don't agree with it. I think that it just enables people to just basically keep doing what they're doing.
I know lots of people, not lots, I know a handful to a dozen people down at at Cornerstone. And a couple of weeks ago, there was 7 in an hour that dropped because of the fentanyl. 7 of them in 1 hour.
So this is going to keep people safer.
Yes, by all means. It'll save lives. It'll save hassle on the community, because if the addicts don't have their fix, then they're going to go out and steal.
We know that with the opioid crisis, we're losing people to overdose death every day. So anything that we can do to help people operate in a more safe way helps to save lives.
And why is it necessary for it to be injectable? As you were saying, there was an oral drug that was similar available in the past. Why does that not work for some people?
It has been involved in the treatment spectrum, and we've been doing it in BC and Vancouver since 2012. Throughout the course of the time since 2012, there's been a lot of evidence to show that it is an effective way to help people who don't respond or can't retain themselves in the oral programs.
Okay, and you've made the decision to have this service available right here in the Health Services building.
Yeah, it is being delivered out of the clinic or the downtown location.
Have you had, any time you've got the health authority, doing that, like providing an opioid, I think it's something that not everybody's ever going to fully wrap their head around. But have you had any pushback from people about moving to this program?
There's a lot of dialogue about it, but at the end of the day, it's supported by evidence, and we know that it works for the population that we're trying to reach, we've not been able to reach successfully before.
It must be tough. I mean, you only need to look around and see that. I mean, it is a big problem, and it's a tough job you guys have to try to solve it. Do you ever feel like we're making headway?
Some of the stories coming out of the patients that we're involved with, it tells us that we're helping people move along their journey to recovery.
And you truly believe that this is part of a pathway to success?
We're seeing results with this that we haven't seen with our other programs for the population that it's intended for.
All right, Danielle Cameron, thanks for telling us about it.
Thanks, Kent.
And thank you for watching Kelowna Now.